it's more effective, we'll use a passive motion, most likely initially, and then build up to an active motion for a more effective treatment. Each ART treatment is like a mini examination and treatment together. I'm going to use a manual contact to first examine the soft tissue structures and really pinpoint which structure is going to be addressed on that session, or a combination of other structures. And so that'll change from time to time. It treats problems with muscles, tendons, ligaments, nerves, and fascia. It can be any of those structures individually, or it could also treat sometimes problems we develop with the combination of some of those soft tissue structures. So something I like to show the patients is a visual diagram or animation that kind of shows how once the tear and the scar tissue develops, what that looks like within a soft tissue structure, or within a muscle in this case, and how that can become a bigger problem and affect other adjacent structures. So let's go ahead and take a look at it. It's important to note with the muscle that all the muscle fibers travel in the same direction, and so they are parallel to each other. And so in this picture we show the muscle belly with two tendon attachments. So let's just say this is your bicep muscle. And so this muscle, nice and healthy, again, no tears, all the fibers traveling in the same direction. This muscle would be able to contract and stretch very well. Again, proper function is what we're looking at here. And so say you've had some type of injury now, maybe a tear, you were trying to lift a box that was a little heavier, and so we've got a tear now that's developed within the muscle belly. So these muscles have torn apart, and the muscle's not going to like this, so it's going to try to fill this gap, fill this tear area. And so after the inflammatory process of the body, you're going to be left with some scar tissue. What's important to note about the scar tissue is that these fibers grow in all directions, so kind of just a mesh or a cast over that gap, and it's going to help fill in that void in the muscle belly. But again, really important to note that these fibers grow in all sorts of different directions. This is going to be a troubled spot. This is going to create an area where the muscle is not going to function properly. And again, that's what active release was designed to remove, is that knot there, that scar tissue, or that really fibrotic tissue there that's within the muscle belly. You know, the body's three-dimensional, so we got structures laying on top of other structures and traveling in different directions. So, you know, you may have this muscle now that comes in at a different direction and comes in contact with that muscle. Over time, that scar tissue now is going to start spreading and will start affecting that adjacent muscle, creating a problem and creating some scar tissue within that structure, and that's what we see here. Within the adjacent structures may be a nerve, and that's what this diagram shows. It shows a nerve that travels, say, pretty close there to that scar tissue, and as that scar tissue, again, as that adhesion starts to grow thicker or bigger, it's going to affect that nerve. And it's basically another form for a nerve to become irritated or impinged on, and this is why active release is so effective. It's able to address all these different structures, and there's protocols that will help stretch out and break apart, you know, muscle between muscle or muscle between a nerve, again restoring proper function and that slide is what we're looking for between these structures.